friends, welcome to Studio Homeopathy. It is Ramadan and you can see I'm at Muhammad Ali Road near Minara Masjid. Lot of food stalls, lot of things to do, lot of colors. Wow, look at the atmosphere, it's so dynamic. Now in this, sometimes you can also fall ill, and for that homeopathic medicine is nothing but the best. So let's bring on something, and post my presentation you're going to see that yes, we are also going to take you to some lovely food stalls. So wish you a beautiful Ramadan, a beautiful festival, and God bless. Take care. Bye. Hello friends, welcome back from the chaotic Muhammad Ali Road. Wow, it's an experience. Okay, so getting back to those complaints and the homeopathic remedies helpful in GI complaints during festive seasons. Ramadan is a sacred time of the year for millions of Muslims all around the world. To be precise, Ramadan is a month of intense prayer, dawn to dusk fasting and nightly feast for the faithful. As per Islamic belief, this fast aims to bring the faithful closer to God and to remind them of the suffering of the least fortunate. It is also a festival in which people relish good delicacies post long hours of fasting. Post iftar, you'll see hordes of people heading to these festival food bazaars. Delicacies like chicken tikka, shawarma, kebabs, paneer, malpua and sweets are in abundance. Now, what happens is, post-fast, when you eat all of this, there is common clinical conditions which we encounter in our practices, mostly the gastro-intestinal complaints. Complaints like dyspepsia, or commonly called as acidity, diarrhea, constipation, and in general, indigestion, which includes a lot of flatulency. Now, to deal with this, the common remedies are there in homeopathy which work wonderful. Arsenical, pulsatilla, china, nux vomica, and sometimes in acute manifestations, or sometimes when you get a midnight emergency, Aedes nigra, rubenia, and magnesium phosphate can work wonders. Now, when you want to prescribe, you have to be fast and you have to be quick and you have to be very sure of the results. So, coming up to arsenical, stools of the arsenical, where the patient would actually tell you small, offensive, dark with much prostration, worse in the night, worse after eating and drinking. Now, all of these ailments of arsenic basically comes from vegetable diets and watery fruits. If you go to an iftar party, you'll commonly see that there are a lot of watery fruits, and some people can get aggravated by eating this. Vinegar, ice creams, ice water, strong cheese, and lastly spoiled meat, which is of course also seen in many parts of the country where people use this kind of meat for people, and they can give a lot of complaints. Fatak says, burning thirst for ice cold water, drinks little but very often, which again is vomited out, which is a very characteristic symptom of arsenical. Tyler says loathing of food. So you can understand a person like arsenical, who's so fond of eating, comes down with these kind of complaints. But thirst is again very important. On the other hand, burning in the abdomen has to be present, and burning is better by sweet milk, and something which is very contradictory. Instead of the burning being better with cold, it's better with warm drinks. Patient has a very peculiar craving for coffee. Now, in conditions requiring arsenical, you have to always see that patient also has this kind of thirst, the kind of burning, but there is a lot of prostration along with restlessness, which is seen in arsal. Very similar prostration we also see in a remedy like china. Now, china, the stool is basically painless, yellowish, with undigested food particles, which is again aggravated more towards the night. But here in China, there is a lot of colic, and this colic of China is much triggered like the gallstone colic. Patients, they do not like taking milk because milk disagrees, and more importantly in China, the flatulency is the key for prescribing, where patient says, even if I am passing this flatus out, I am not feeling better. Belching of bitter fluids or having a bitter taste in the mouth is very characteristic of China. So that was china and that was arsenic. Now coming up to pulsatilla. In pulsatilla, the red line symptom is patient has eaten a very rich, greasy food or something which a lot of fatty food. Cheese and fatty food is the ailments from in pulsatilla, in even cakes. Now stools, as Alan very clearly describes it, the diarrhea is usually in the night, which is more watery but very changeable. Now when I say changeable, sometimes it is greenish, sometimes it is yellowish, so there is always a change in this color, and that actually you can prescribe pulsatilla on that basis. Patient is not very thirsty, is thirstless, There is water brash with foul taste in the mouth. Now, taste of the food which can actually remain for a long time, pulsatilla can be one of the remedies. Now, along with fat, this patient does not like butter, and onions completely disagree. Pain in the stomach comes on basically an hour after eating. So patient has gone to a restaurant and eaten this kind of meal, and after 1 hour he comes with this ache in the abdomen. Pulsatilla can be one of the remedies to be thought of. Nash very clearly says stomach which is better with cold things, contradictory to arsenic, in pulsatilla patients are very much better drinking cold things. Most importantly, the other remedy which is commonly also given and prescribed is nux vomica. Now, nux vomica doesn't very classically have this kind of a diarrhea, but a very peculiar stool symptom. Constipation with frequent unsuccessful desire, passing small quantities of stool. So something like diarrhea, where a patient goes very often and patient is going to pass a lot of stools. Here the patient is going very often but not passing a good quantity of stool, but very, very little quantity of stool, in which the first part of the stool is soft and the last part is quite hard. Allen says ailments with highly seasoned food, which again, in such festive season which you commonly see. Spicy food, overeating, overindulgence, abuse of tea and coffee are the remedy. Of course, alcohol, which is also one of the key ailments in nux vomica. Now, the key symptom is in nux vomica, post this, the patient actually feels a lot of nausea and vomiting. Patient says, if I could only vomit, I would feel so much better. So patient actually feels that, doctor, I feel if I get that whole thing out, I'm going to feel better. So that's a very classical symptom for nux vomica. But now, so that's nux vomica, pulsatilla, china. But sometimes, you may get a call in the midnight, and sometimes the symptoms are jumbled up or together and you do not know what to prescribe. So you can think about remedies like Abies nigra, Carboveg, Macphos. They can actually help you out of a crisis situation. Now, one of the leading remedies which I have prescribed in my clinical practice is Abies canadensis. Here the patient eats a lot, beyond capacity. Wow, he's enjoying his meal, so he's really going to eat a lot. But with that, patient develops a lot of burning, lot of distension of the stomach, and with that, patient comes with palpitation. So the wife is going to call you and tell you, doctor, my husband is actually getting like a heart attack. He's having so much of palpitation. Abies canadensis can be thought of, but please examine the patient. You have to take his pulse, his blood pressure, examine his cardiac, and then of course you can go ahead with Abies canadensis. On the other hand, a lot of flatulency. Two very important remedies, asafoetida and Carboveg. Asafoetida, the symptom is described as globus hystericus. That means patient feels as if something is coming up, regurgitation of liquid gurgling all through the esophagus into the mouth, rolling of wind which escapes afterwards with loud and difficult eructations. So patients with having a loud eructation, asafoetida can be one of the remedies. Lastly, the star of materia medica for flatulency is Carboveg. Eructations, heaviness, fullness, flatulence and pain with worse when the patient is lying down. Abdomen feels greatly distended, where the patient actually feels, oh, my stomach is so tight, but is better when passing flatus and patient feels so much better. Especially, that is what is called, even in children you may see this, with flatulent colic is you can prescribe Carboveg. Other remedies, something like Rubinia, where one of the most beautiful remedies, where actually patients come and say, doctor, I'm having a lot of acidity, but along with acidity I'm getting headaches. So whenever acidity with headaches, Rubinia can be thought of. So intensely acrid eructations with frontal headaches, I think Rubinia can be one of the remedies. Lastly, homeopathic antispasmodic, something which works as wonderful as something like a Spasmo, Proxivon or something, Macphos. Now a great antispasmodic remedy, flatulent colic, where the patients are forced to bend double, relieved by pressure and warmth. Now here, what exactly the patient does is feels better by warmth, but patient has a belching of gas but no relief. You can give these biochemic remedies in a 6x potency and it works wonderful. So friends, you can be actually a great savior, with simple prescriptions, especially in GI complaints. Use these medicines judicially with frequent repetitions. Potency can be as low as 30, but can be also frequently used. So I hope you enjoy this short prescription, and it's time for me to get back because the whole team is waiting there and I don't want to miss out on fab delicacies. Thank you. So friends, I hope you enjoyed our talk on various homeopathic medicines which can actually help so much of GI symptoms. And homeopathy, as you know, works wonders. Now, there's a lot of food behind, and my cameraman and the entire crew is actually now waiting to go and eat and have a blast. So you guys also enjoy, have a beautiful season. All my love to your entire family, with due respect to every religion. I think we are all together. So God bless, and have a very beautiful Eid and Eid Mubarak much in advance. Take care. Good night. Shabba khair. Khuda Hafiz. Bye.